Today we've been called out to a 19-year-old female. Her mother's called the ambulance because she's come home feeling short of breath. On arrival, we did a quick ABCs check and we've identified that Holly does not need any immediate interventions at this stage. So I'm going to move forward and do a full secondary survey. Hey Holly, so where's the ambulance been called for you today?
I just can't catch my breath, and I don't feel right in the head.
Okay.
Yeah, sorry.
Alright, no worries. What were you doing when this came on?
I was running, and then I just couldn't catch my breath, and then I started feeling a bit dizzy.
Okay.
And then I called my mum, and she came and picked me up.
Okay. Have you got any medical conditions that we should be aware of?
I have asthma, but I haven't had an attack in a while.
Okay. Have you taken your inhaler yet?
Mum got it for me just before.
Okay, cool. So you've just taken your inhaler, is that right?
Yeah.
Alright. So I'm just going to have a quick feel of your wrist. You just focus on getting your breathing right. I'm just going to be taking a quick pulse. While I'm doing this, I'm feeling for the warmth of Holly's skin, and her pulse is regular and strong. There's no obvious carpal spasm in her hands, which can help to rule out hyperventilation syndrome. Her pulse is sitting at about 105 beats per minute. She's got a good colour, not blue, which can rule out peripheral cyanosis. Cap refill time is about 2 seconds. She's sitting in the tripod position, which is usually the most comfortable when people are struggling to breathe. And Holly doesn't appear to be swollen or have any rashes on her face or neck that I can see. No obvious contusions, she's not sweating. Appears well perfused overall. You've got no allergies to anything, do you, Holly? No. Okay. Alright, if you don't mind, I'm just going to have a quick listen to your... before we do this, we would also... Usually we would expose the chest and have a look, but because we're videoing we won't. We'll be looking for any scars, any bruising, deformities, intercostal indrawing, which could show a very increased work of breathing. At the moment she's struggling to breathe, but not over the top. Okay, so next I'll have a listen to your chest if that's okay with you, Holly. I'm just going to be moving my stethoscope around, so take a big deep breath every time that I move it. In through your mouth, please, hon. Thank you. Alright, we've got a slight wheeze more in the central zone, which is consistent with asthma. And under your arm, thanks, hon. And the other one. There we go. Alright, I'm not hearing any crackles or bubbles, which can help to rule out CPO or pneumonia, so fluid in the lungs. Have you been well recently?
Yeah.
Yeah, no coughs or colds or phlegm or anything? Cool. I'll also just have a listen to your back, just to be thorough. So big deep breath through your mouth every time I move it. Thanks. Once again, normal lung sounds in the peripheral lobes, a slight crackle through the middle, wheeze, sorry, not crackle, which is indeed consistent with an asthma attack. So, are you feeling a bit better with your breathing at the moment?
Yeah.
Does it feel like the inhaler's doing the trick? Okay, cool. Have you ever been admitted into hospital with your asthma before?
No.
Okay, that's good news. Can I just get you to lie back on the couch for a second and look out the window for me? Cool, so I'm just assessing for any jugular venous pressure increase. None that I can see, which is good because that could indicate heart failure, so the blood's struggling to get back to the heart. You can sit back up now, hon. And when I look at her, I can't see any tracheal deviation. Just going to have a quick feel of your neck. It all appears intact. Tracheal deviation could be an indication of a pneumothorax, as would lack of lung sounds in one half of her chest. Holly, I'm just going to percuss on your chest, so that means I just put my fingers on your chest and do a quick tap, so I just need to hear for the sounds that it makes, alright? Thank you. So any hyperresonance could be, widespread hyperresonance, could be indicative of if there was extreme asthma, so if she was having a severe asthma attack, and if there was unilateral hyperresonance, it's all good, and I'll just do it on your back as well. Unilateral hyperresonance could also be indicative of a pneumothorax. There is none that I can hear so far. And over dullness could indicate fluid in the lungs due to pneumonia or CPO or a hemothorax, but I can't hear that either. So everything sounds good and clear, or normal lung sounds when I percuss. And Holly, you also mentioned you felt a bit dizzy, is that right?
Yeah.
Okay. Have you got any tingling in your hands or in your mouth? Nothing like that? Okay. And there's no family history, any conditions that run in your family? No. Okay, cool. So I've just got to do a few more checks. So first off, I'm going to get you to squeeze my hands as tight as you can. Cool. Equal grip, that's good. And give me a good, nice big smile. Awesome, no facial droop. So that can start to help to rule out stroke. I'm also going to just shine a light in your eyes. So I'll get you to look at my finger. Pupils are equal and reacted to light, which is good. So if there was any increased intracranial pressure, that could affect her ocular nerves, and we would see abnormal reactivity to light in her eyes. Just have a look at my finger and watch my finger for me. And in. There we go. Yep, looking all normal. Okay. One more thing I'm going to get you to do. I'm going to get you to stand up slowly. Let me know if you feel any more dizzy. Feeling all right? Okay, so pop your hands by your sides. This is just called the Romberg's test. And I'm going to get you to close your eyes and stand upright for a few seconds. You feeling steady? No spinning or dizziness? No. Alright, that's good news. We'll sit you back down then, hon? No headache or blurry vision either? No, just the dizziness, eh? Okay, I'm just going to take a quick blood pressure. Because if we get a high blood pressure reading, that could indicate that there's something a bit more going on to your dizziness, such as stroke or increased pressure up in your brain. But at this stage, it seems unlikely. We'd usually roll up the sleeves, but long sleeves are a bit hard in this one. Okay, so her blood pressure's sitting at about 125 on 80, which is all good. I got my off-sider to do a few pertinent vital signs earlier during the primary survey. Those results included a rest rate of about 22, which is likely to have come down by now. Heart rate was 105, which I got earlier. The SpO2 showed 97%, which means she's well perfused. Temperature and blood glucose were both normal. We just took those because normal temperature can help to rule out infection or sepsis as a cause of her shortness of breath and dizziness, and blood glucose can help to rule out hypoglycemia, which dizziness may also indicate. Have you eaten today, hon?
I had a piece of toast for breakfast.
Okay, good on you. Cool. So, how are you feeling at the moment?
I'm feeling better.
Yeah? Does it feel like your asthma's died down a bit?
Yeah.
Not too strong anymore?
Yeah.
Okay, so as Holly's symptoms appear to have self-resolved since she's taken her medication, we would consider not transporting today, but we would obviously do the red flags checklist for respiratory issues and for neurological issues, as well as the non-transport checklist. But as she's home with her mum and all our vitals, signs and observations have kind of come to the conclusion that this was just an asthma attack, we would feel likely comfortable to leave her at home under supervision.